Hi, so this is in continuation to the parenteral medication administration. So next is the intramuscular injections. So intramuscular injections are injections into a muscle tissue. Medications are absorbed more quickly because of greater blood supply to the body muscles. So muscles can also take a larger volume of fluid without discomfort than subcutaneous tissues can. So these are the sites, the ventrogluteal site, in the gluteus medius muscle, which lies over the gluteus minimus, is the preferred site for IM injection because the area contains no large veins or blood vessels. It provides the greatest thickness of gluteal muscles, is sealed off by bone, contains consistently less fat than a buttock area, thus eliminating the need to determine the depth of subcutaneous fat. And the other one is vastus lateralis site. This muscle is usually thick and well developed in both adults and children. So the dorsogluteal site is composed of the thick gluteal muscles of the buttocks. So this site can be used for adults and for children with well-developed gluteal muscles. Deltoid site, the deltoid muscle is found on the lateral aspect of the arm. Rectus femoris site, the rectus femoris muscle, which belongs to the quadricep muscles group, is used only occasionally for IM injection. It is situated on the anterior aspect of the thigh. Now, for the assessment, you have to assess the allergic reaction to the medication, specific drug action, side effects, and adverse reactions, tissue integrity of the selected site, client's age and weight to determine the site and the needle size. So for the administration of the intramuscular injections, you have to prepare the syringe, which is 1 to 3 ml, needle size 19 to 23 in gauge, alcohol pads, medication record, disposable gloves, medication ampule or vial. So the implementation, you have to check for the medication sheet, follow the 3 checks, which are when it is taken from the medication card, before withdrawing the medication, and third, after withdrawing the medication. So you have to double check the drug 3 times. Now organize the equipment. Now for the procedure, you have to perform the hand hygiene and observe the appropriate infection control procedure. It is to prevent the spread of microorganisms and dirt. So you have to do the proper hand washing or hand hygiene. Prepare the medication from the vial or ampule. So what we have here is already prepared. For the drug withdrawal, it is to prevent medication error by providing an additional check. So you have to double check all the time, from the beginning till the procedure and also at the end of the procedure. Now provide privacy to make patient feel comfortable. You also have to introduce yourself and verify the client's identity. So you have to ask for the go to the patient chart and check if it has if you are talking to the right patient. So you ask for the name and also the age. And also on the patient's bedside, you will see there the name of the patient, like usually in the Philippine hospital setting. So it is to establish rapport and to prevent medication errors. Now assist the client to a position depending on the chosen site. So it is to easily retrieve and get the accurate information. So for vastus lateralis, lie flat or supine with the knee slightly flexed. So lie flat in a supine position with the knee slightly flexed. For ventrogluteal, lie on the side. So you have to lie on your side or back with the knee and hip slightly flexed. So you have to expose the hip part. Then for the dorsal gluteal, lie prone with feet turned inward or on side with upper knee and hip flex and place in front of the lower leg. Now you also have to explain the purpose of the medication, including relevant information about the effects of the medication. It is to foster understanding and cooperation, knowing what is happening, and it also helps minimize patient anxiety. So select a site free of skin lesions, tenderness, swelling, redness, bruise, anything. It is to get the accurate reaction of the medication. And locate the exact site for the injection and put on gloves to prevent patient-nurse cross-contamination and spread of microorganisms. Now you have to clean the site with an antiseptic swab from, again, inner canthus to the outer canthus in a circular motion. And remove the needle cover and discard without contaminating the needle. And it is to prevent accidents. So you have to use the owner's side of the non-dominant hand to pull the skin approximately 2.5 centimeters, 1 inches to the side. So you have to grab or like pull the skin approximately 2.5 to 1 inches. Like, so you have to grab, you have to pull the skin outward. And then hold the syringe between the thumb and forefinger. So you have to hold the syringe, thumb, forefinger of the dominant hand. So this is my dominant hand. Now inject needle quickly and firmly at a 90-degree angle. And insert the needle to the muscles. So you have to insert the needle to the muscles. Let's say this is the muscle. 90 degrees. And next is release the skin. So just release the skin. Hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back. You have to aspirate. Pulling back with your dominant hand. Aspirate 5 to 10 seconds. Now slowly inject the medication. So you have to slowly inject the medication. So because if you will inject the medication abruptly, it can cause like pain to the patient. So quickly withdraw the needle while applying pressure to the sponge. So quickly to prevent unnecessary pain to the patient. So you have to assist the client to a comfortable position. Then discard the uncapped needle and syringe in a safe receptacle. So have to discard this one to prevent accidental needle injuries. So you have to make sure that the needle is discarded in the container for the used needles and also the syringe. They have their specific bins or place where you can put them to prevent injuries. Then you have to remove the gloves and wash your hands to prevent the spread of contamination and infection. Now, you have to make sure to document all relevant information. It's for legal purposes. So, that's it for parenteral medication.